Ruthless Compassion is a podcast that shows you how to become fiercely kind. I'm the host, Dr. Marcia Sirota, and in each episode, I get into it with experts and regular folks about the things that get in the way of what we want. Things like addiction and mental health, isolation and loneliness, difficult family and work relationships, and the importance of self-care. I want to help you overcome the obstacles to living your best life, and I want to inspire you to become a powerful kindness warrior. Maia Szalavitz is the author of the New York Times bestseller, Unbroken Brain, a revolutionary new way of understanding addiction, which is widely recognized as an important advance in thinking about the nature of addiction. Her book, Help at Any Cost, How the Troubled Teen Industry Cons Parents and Hurts Kids, was the first to expose the damage caused by the tough love business that dominates adolescent addiction treatment. She has written for numerous publications, and she is author or co-author of 5 other books. She has won awards from the National Institute on Drug Abuse, the Drug Policy Alliance, the American Psychological Association, and the American College of Neuropsychopharmacology for her 30 years of groundbreaking writing on addiction, drug policy, and neuroscience. Welcome, Maia Szalavitz, to the Ruthless Compassion podcast.
Thanks so much for having me.
Well, it's very exciting to have you here because I've always been interested in the topic of addiction, and so I'm very interested in your approach. I wanted to ask you how you got interested in this topic of how to treat people who have addictions.
Sure. So I had my own addiction when I was in my 20s. I was addicted to cocaine and heroin, and I was injecting, and I was a total mess. And I had, come from your so-called nice middle-class family, and, according to the stereotype, which I now know is racist, that wasn't supposed to happen. And I was at Columbia University, and, I had been a straight-A student and all of this kind of stuff. And I just went completely off the rails. So I wanted to understand what had happened, and I wanted to understand why our drug policy and our treatments for addiction just are so stupid. It was just like from just that experience, I could tell, well, if you look at how we define addiction, either in DSM or in, wherever it is defined by experts, the definition is compulsive drug use that continues despite negative consequences. So, why are we using punishment, aka negative consequences, to treat the thing that we know is resistant to punishment? Why are we using law enforcement? Why are we using harsh treatment that's about confronting and attacking people? So I kind of became obsessed with this, and one of the things that I found out actually kind of led me to my addiction was I was always a really obsessive sort of person. And it turned out that if I had been growing up now, I probably would have been diagnosed with Asperger's syndrome because I was very, very obsessive, very into my special interests, difficulty socializing, oversensitive to sounds and touch and all of that kind of thing. I just sort of started throwing myself into the science and making addiction my new special interest, understanding a lot more about it. One of the things that's really frustrating in this area is just that it's really complicated. And everybody wants to say it's like a simple thing, oh, drugs hijack your brain or whatever, And it's not that simple. That's not, when you look at what happens to people with addiction, we actually are making choices during addiction. Like, nobody's shooting up in front of the cops. Now, that doesn't mean we're making very good choices, and it doesn't mean that we don't have impairment around our choice around drugs. But that's very different from being a complete zombie with no free will, right?
Uh-huh.
So, it's just in this area, I just got really into, kind of learning more and more about it. And, what was very clear very quickly was that pretty much everything people are taught about addiction is not accurate.
What do you mean by that? Because that's quite a strong statement.
Yes, and it's slightly exaggerated, but the the point there is that, for example, we think that, the way to fix addiction is tough love. Well, if it's resistant to negative consequences, that's a really dumb way to fix it, and in fact, it has killed people. We think that, if we just stigmatize people enough and criminalize them enough, they will suddenly stop using. That isn't what works. We have this idea that the only way people can recover is if they hit bottom, aka experience worse and worse consequences. That's not correct. We think that if you use medication to treat addiction, that's just substituting one drug for another. That's not correct either, because addiction is compulsive drug use that continues despite negative consequences. If the consequences of your drug use are positive and you are getting better, that's not an addiction. And so if you're using medication that is working, so there's just all kinds of stuff. Everything from the idea that everybody who touches drugs get addicted. In fact, only about 10 to 20% of people, even with drugs like heroin. So there's just this massive amount of misinformation, and that is also sort of constantly being spread by the media and by people with various agendas.
Well, speaking of agendas, I was very interested in your point of view about the 12-step programs, because I have my own opinions of those. I've even written blogs about them. So what are your thoughts about the 12-step programs?
Okay, let me start by saying that it's complicated. And let me also start by saying that I have no opposition to people working the steps, engaging in 12-step support, doing what works for them in their own recovery. What I do object to is viewing 12-step programs as the fundamental core of addiction treatment and making people pay to learn about working the steps when you could learn that for free and having your insurance pay for that. That just, to me, it violates the AIDS tradition, it wastes money, it creates all kinds of issues around addiction being seen as a moral problem because there's no other disease for which the treatment is needing confession and prayer. So it's just when 12-step is a self-help program that is voluntary, it is wonderful and great. When it's forced on people and when we replace things that don't have those kinds of problems like cognitive behavioral therapy that aren't available for free, and we charge $58,000 a month for you to basically get indoctrinated into 12-step, that angers me. And it especially bothers me when people believe that you can't take medication for opioid addiction because the 12 steps say that, that's like cheating or something. Unfortunately, Narcotics Anonymous has an official policy that you're not really in recovery if you are on medication, and that is killing people. We have 2 drugs that cut the death rate from opioid addiction by 50% or more, and they are methadone and buprenorphine if you use them long term. So telling people that they're not really in recovery if they're taking those medications is horrifying because you're basically doubling your odds of death. People often don't get about my position about the 12 steps. I think that every human being could benefit from taking moral inventory and making amends to people and all that kind of other stuff. I think that can be a really useful process for everybody. I just have a problem with seeing that as the treatment for addiction because it means that addiction is sin fundamentally.
I really agree with you. I think that it's very interesting how people who are suffering from addiction are told that they have a moral failing. How do we get past that?
Well, I think one way we get past that is to take the 12 steps out of professional care and let addiction be a medical and psychological disorder that it actually is. There's many conditions, like if you have, say some kind of cancer and you go to a cancer support group, that support group can be what saves your life, and that can be deeply religious or spiritual or whatever it is, and that can just get you through the horrible experience of chemo and whatever, right? But you don't want them prescribing the chemo. And there's nowhere else in medicine where basically the patients are telling other patients what their medical treatment should be.
You're right. The people who run the 12-step programs are lay people, not medical professionals or psychological professionals.
And that's the problem. And I mean, to AA's great credit, they have a pamphlet that, I'm going to space the title, but it's something along the lines of "We Are Not Doctors," and it tells people that don't tell people to come off their medication. This was basically referring to antidepressants because suicide is resulting. And that pamphlet should be in every rehab program, and people should be aware that AA's official position is not for or against medication. NA is different. So I think, the way forward with addiction is we need to decriminalize possession of drugs. You can't destigmatize a problem while you criminalize it, because criminalization, the whole point is to stigmatize it, right? We also need to stop having prevention programs basically demonize addiction. And we need to treat it like any other illness. And that means that, the doctors are the ones who have the final say. Not to say that patients don't have autonomy and choice and should be treated well. But, in the rest of medicine, if somebody, tells you what to do and is completely paternalistic and is mean to you, we consider that, bad bedside manner, right? But in addiction, that often is the treatment itself.
So what are your thoughts on a better version of treatment for people who have addictions?
So what I would do, and what I try to advise people who ask me to do, is the first thing you've got to do when you have somebody with addiction is treat them with compassion and respect and meet them where they are. If that means they're not ready to stop using, you have to help them do harm reduction. You guys in Canada do have some heroin prescribing, which should be expanded. I think in Vancouver they are considering expanding Dilaudid prescribing, which is hydromorphone, which is probably easier because that's a pharmaceutical that's used around the world, unlike heroin, which is only available in certain countries as a pharmaceutical. So you really need to first keep people alive. And we have an opioid supply that is contaminated with fentanyl, and it's Russian roulette every time you are using. So we need safe injection spaces. We, more than that, need a safe supply, and we need to, meet people where they are. Okay, so once we do that, a lot of people actually do want to stop. So how do we help them? For one, methadone and buprenorphine needs to be available to everyone who wants it, and it needs to not be a pain in the butt to get, so you don't have to get urine tested 20 times or show up every day or any of these other things that make it feeling like chemical probation. We also need to have strong psychological therapies available, and everybody who gets treatment needs to have a complete psychiatric assessment, including for trauma. So most people with addiction have either mental illness, which is about 50%, trauma, which is about 2/3, and a lot of those cases overlap, or some other source of despair. If we don't deal with those fundamental issues, people don't get better. So if it's trauma, you can't poke around at it and force people to reveal it, because that'll re-traumatize them. But when they're ready, we need appropriate trauma-sensitive care for them. Also with mental illness, some people are going to need medication, some people are going to need talk therapy, many are going to need both. It needs to be tailored to the individual. And if you have somebody whose life has been lived in extreme poverty, has no education, has mental illness, has trauma, you have to realize that this is going to be a long, complex process to recovery generally, and they're going to need a lot of support. And by support, I don't mean coercion.
I really like that approach, and I think that's very humane and very common sense.
Yeah, I mean, the thing that we seem to be missing with addiction, and it's interesting, I actually wrote a book about empathy. And, that's what we're missing. We just don't get that people with addiction are people. And they behave in this strange way that is really easy to understand if you just think about it as they're in love with a drug, or they think the drug is like their child, and they're devoting their energy towards that because that's the way evolution designed us to do, except it's now misdirected towards a drug. When you see that, you can see exactly why people behave so strangely, and you can also realize that, hey, when you break up with somebody, it's hard, and you have to sort of unlearn all those cues about, oh, this song makes me want to see him, and this cologne reminds me of her, and all of that stuff. Like all of that is the learning that occurs in addiction and love. You learn to associate these cues with a person, and they become very difficult to get rid of. So we need to teach people about what it actually is and give them the coping skills so that they can find other passions. And if, for example, like me, they have difficulty connecting with people because of a fundamental way that they're wired, we need to help them learn how to manage that so that they can. And, all of this, like temperament, predispositions, social conditions, and, just the environment really matters. But if we are compassionate and we just listen to people and we just ask them what they need, we can make enormous progress. Now, that's not to say that within people with addiction, there isn't a group that has antisocial personality disorder, which means that basically they give the rest of us a bad name because the lying and manipulativeness and the callousness and coldness that is associated with that has unfortunately been associated with everybody with addiction, even though it's probably only about 20% of people with addiction that have that. So it's complicated, and we need to work with what is driving somebody's addiction. Unfortunately, for the antisocial people, we don't really know what to do. But for everybody else, we have a pretty good.
And I wanted to ask you about the inherent racism in the way our society deals with people who have drug addictions, because I think that's a very significant factor, isn't it?
Absolutely. I mean, the thing to realize is that our drug laws were made because racism. Like, nobody sat down and said, hey, marijuana is the most harmful drug out of marijuana, alcohol, and tobacco, so let's make that illegal. Because you couldn't scientifically do that if you had a brain. The reason marijuana has traditionally been illegal, and congratulations to Canada for getting rid of that racist nonsense, is because we associated it with black people and Mexicans. And since the white people were in charge, we outlawed those drugs. And we made the drugs that we like, alcohol, caffeine, and tobacco, legal, and we don't even call them drugs. Opium, in societies where it was used, it's hard to tell whether it's more harmful than alcohol or not, because physically it doesn't eat your liver. And, if your addiction is managed, you can do just about what everybody else can do, and you're less impaired than if you have active alcoholism, right? So again, like, the laws were just made because we associated the particular drug with a foreign group or some immigration fears. And once we realized that our drug laws are based on, like, racism rather than science, we can begin to think about, okay, what substances should be legal for recreational purposes and how? How do we deal with the fact that, capitalism would love to have, say, Philip Morris fentanyl, right? We don't want that. But we also don't want people dying from illegal fentanyl of varying qualities that hasn't even been tested on animals. So we have to find a way to balance the harms that are genuinely associated with the substance and the harms that are associated with capitalism and selling addictive substances, and people's right to alter their consciousness, because human beings have always done that. We've done it before we even evolved into humans. We can see birds and cats with catnip. Birds drink alcohol. They get quite drunk. So it's this is like a thing that is way deep in our evolutionary history, and frankly, altering consciousness is a human thing. So how do we reduce the harm with that? We don't put spikes under mountains so that hang gliders won't hang glide. We recognize that that's a dangerous activity that people voluntarily engage in, and we might personally think it's stupid, but making it riskier is not going to help anybody. And so similarly, we have to respond to drug-related harms.
I really like that point, because what you're saying is that human beings and animals apparently have this kind of part of them that's interested in thrill seeking or in altering consciousness, and nobody makes BMX biking illegal or bungee jumping illegal, but somehow we make smoking marijuana illegal because of the political issues as opposed to just the social issues, correct?
So we need to recognize that our assessments of risk are deeply associated with our values. This may have changed, but for a long time it was actually much more dangerous to climb Mount Everest than it would be to shoot heroin for a year. Now, fentanyl may have changed this calculation. Nonetheless, if you climb Mount Everest, you're generally seen as doing this bold exploratory thing and challenging yourself, and nobody says you're a horrible, selfish person, even though you have at the last point I checked, it was something like a 1 in 10, a really high risk of dying. If you shoot heroin for a year, pre-fentanyl, probably 1 to 3% per year risk of dying. Now, I'm not recommending this. That's a horribly high mortality rate. But what I'm saying is that it's our values that make us say that one thing's okay and possibly heroic, and the other thing's evil and selfish. So we really need to try to reduce risks, and we should not be focusing on stopping people from getting high, because then we're going to have to ban music, we're going to have to ban the internet, we're going to have to ban sex, we're going to have to, it's basically impossible. The Puritan mission is ridiculous, and we need to worry about harm, not euphoria. People are always going to seek various forms of relief and comfort and pleasure, and frankly, that's how you get modern civilization. So we shouldn't be denying that we have these tendencies. We should be trying to minimize the harm associated with them.
I really agree with you. I think that's a very wise point of view.
Thank you. It's just I am currently working on a piece about pain patients who unfortunately are being cut off from medication that works for them because other people have addiction. And this is doing tremendous harm. Some of them are actually killing themselves. And the pain and distress that you hear, I just interviewed a whole bunch of them, and just to interview them is painful. That is wrong. Our fear that they might have some extra euphoria or that they might, turn into an addicted person is greater than our fear that they are in agony of burning flesh 24/7 and want to die, right? Why is that? That's really ridiculous. We should want people to feel good enough to get out of bed and, play with their cats and hang out with their grandkids, not worry about, oh gosh, they might be a little spacey,
But I think you're right. I think we have a real puritanical prohibition against euphoria and pleasure, even though, as you say, since the dawn of time, all living beings, all sentient beings have wanted to have those transcendent states, those euphoric states, those pleasurable experiences. So somehow the Puritanism has gotten into our society, and we punish people who want to experience these things or even have that sense of relief, as you talk about.
Well, I mean, one of the things that's also really weird about it is, okay, if you're rich. If you're rich, you can go and say, hey, I need some sleeping pills because I'm stressed, or I need to stay up all night, so here's some Ritalin, right? Or Adderall. If you're rich, it's legal. And even if you do something illegal, you're not going to get punished for it. So it's a very hypocritical thing in that sense. And it's also tied into our fear that if people had euphoria by themselves, they wouldn't buy enough stuff or they wouldn't work hard enough. So, it's certainly the case that laziness exists. But it's also the case that the vast majority of humans are driven by a desire to make a meaningful contribution to society. And assuming that the existence of pleasurable things will derail that other natural human drive is also ridiculous. But it is an assumption that is very deeply rooted. And, what's interesting is, people tend to think that, everybody who tries opioids, experiences this, enormous bliss. And everybody who tries that, wants to, just go and do that all the time and give up their family and give up their work and everything like that. First of all, most people don't actually like the experience. Only about a third of people kind of find opioids enjoyable. The rest of them kind of find them numbing or nauseating and all kinds of other things. But second of all, even among the people who find them ultimately blissful, I have heard so many stories of people who, wow, I got OxyContin for surgery and it was the best thing ever, so I knew I could never do it again because I didn't want to mess up my life. That is the healthy reaction when you have a life that is worth keeping. If your life is horrible, on the other hand, why aren't you going to seek the bliss?
Yeah, it's sad because we seem to punish the people who are the most vulnerable, and the people who are in the positions of power get a free pass.
No, and that's the really sickening thing about all of this. And that is to do with not just race but also class. And it's so distressing because it's so hypocritical. And this sort of got confronted a little bit in the 60s when people would be like, hey, the old guy with his scotch is just as bad as the young guy with long hair and the joint. But somehow, we just lost that insight. And now we're finally coming around to realizing that, wow, civilization will not end if you legalize marijuana. But it's really frustrating because when you try to have a rational argument about drug policy, people are assuming things are rational when they are not, and they are assuming that the goal of policy is to actually, help people rather than to sort of enforce these ideas. And if the goal of policy is actually to help people, we're not doing a good job because it doesn't work. You guys do better than we do, although you really need to expand your methadone, Dilaudid, and heroin prescribing in Vancouver before more people die. It just criminalizing this, what you just said, all it does is punish the vulnerable people for trying to be okay.
Well, I'm sure we could go on for a long time having this discussion because it's so fascinating, but I wanted to switch gears a little bit and ask you about your books and what you're currently working on these days.
Sure. So I am actually working on a history of harm reduction. And harm reduction is basically the idea in drug policy that we should reduce harm, not worry about whether people are euphoric or not. And this idea, there's always been iterations of it, but it really gets named and becomes a political movement and a social movement, starting in the 80s with AIDS and starting in Liverpool and Holland, and then spreading across U.S. and Canada and basically around the world. So what I'm trying to do with the book is show how a small group of people who had this idea and championed this idea went from being completely on the fringe to needle exchange being all over the place, to heroin prescribing existing in Canada, to safe injection sites existing there, to marijuana legalization, to the rebirth of psychedelics, and sort of how this quite obvious but obscured idea sort of has come to be a threat to global prohibition.
Very, very interesting. And where can people find you if they're looking to access your blogs or your books?
Sure. So I have a quasi-regular column in Vice, and I am on Twitter way too much at Maia, M-A-I-A, S like Sam, Z like zebra, and you can find me on Twitter, and I usually tweet everything I write. I also have a website that's MaiaSZ.com that a friend of mine thankfully updates because I never do it. And those are basically the best places to find me. This book will not be out for a couple of years. It's the first history of this, and so it's going to be a lot of work.
Well, I really look forward to when it does come out. And in the meantime, I'm going to have to take a look at your other writings. And for the sum up, I was just interested if you have a call to action for the listeners.
Oh, sure. So, really, if you hear something about drugs, be skeptical of it. If you think you know something that everybody knows about drugs, check it. And when you interact with somebody who is addicted or is, using drugs, be kind. Don't assume that by being kind you will do harm. In fact, by being kind you will help people begin on whatever path they have to get better. So, kindness is really what we need when it comes to addiction. And also, really, people should be fighting for harm reduction, for, policies that don't criminalize people, that don't waste money arresting people, and that instead fund evidence-based treatment that is compassionate and supportive.
That's wonderful words to end on. I want to thank you for coming on to the show today, and everybody should definitely check out Maia's social media presence and learn more about this fascinating topic.
Thank you very much.
That was the inspiring Maia Szalavitz, and I'm Dr. Marcia Sirota. If you like this podcast, please review it on iTunes, and you can sign up for my free monthly wellness newsletter at marciasirotamd.com, where you'll also learn about my new online courses.